Visual impairment refers to difficulty with seeing and perceiving what is seen. It occurs due to an eye condition or disorder. Visual impairment in an umbrella used to describe many kind of vision loss, whether it is someone who cannot see at all, that is totally blind, or someone who has a partial vision loss, that is mild to severe visual loss. According to the Persons with a Disability Act 1995, visual impairment is defined in terms of blindness and low vision. Blindness, it refers to a condition where a person suffers from any of these conditions: total absence of sight, visual acuity not exceeding 6 by 60 or 20 by 200 in the better eye with the correcting lenses, or limitation of the field of vision subtending an angle of 20° or worse. Persons with low vision means a person with the impairment of visual functioning even after treatment or standard refractive correction, but who uses or is potentially capable of using vision for the planning or execution of a task with appropriate assistive devices. Multiple disabilities refer to two or more disabilities. The combination of disabilities and the degree of severity of the disability involved impact the functional living experience or differently in each individual. A person with a multiple disability is a person who has a combination of two or more certifiable handicapping conditions whose impact is so severe that the educational needs of a person cannot be met in a program designed for the separate handicapping condition. A child is considered multiply handicapped if she has two or more handicapping conditions that require educational attention. According to this idea stated that a child who has a cerebral palsy which makes it impossible for her to write with a pencil and who also has low vision which makes enlarged print necessary for reading would be considered multiply disabled. A child with the same visual conditions whose reading skills are delayed for no identifiable reason would not be considered to have multiple disabilities. According to the National Trust Act 1999, multiple disabilities are defined as a combination of two or more disabilities as defined in a class 1 of section 2 of the Persons with Disabilities, Equal Opportunities, Protection of Rights and Full Participation Act 1995. A condition with impairment in vision and certifiable handicapping condition causes visual impairment with multiple disabilities. Visually impaired persons with multiple disabilities is a person who, in addition to visual impairment, has at least one other disability regardless of the extent of either, this combination of which causes such severe problems that they cannot receive adequate services in the educational program for visually impaired person or in those established for persons with other handicaps. As no specific definition of visual impairment with multiple disability is mentioned in any act of India The definition of multiple disabilities according to the National Trust Act 1999 can be used as a reference. Accordingly, the definition of visual impairment with multiple disabilities would involve a combination of blindness or low vision with leprosy, hearing impairment, locomotor disability, mental retardation and mental illness. Visual impairment with multiple disabilities need not be limited to the combination of these conditions. It could involve other combinations such as blindness or low vision with autism spectrum disorder, cerebral palsy, muscular dystrophy, multiple sclerosis, specific learning disabilities, speech and language disability, chronic neurological conditions, hemophilia, thalassemia, sickle cell diseases and other health impairments that adversely affect the normal functioning of the individual. A wide variety of etiologies are responsible for visual impairment with multiple disabilities. Etiology of visual impairment with multiple disabilities consists of the causes in other childhood disabilities existing alone such as deafness, blindness and intellectual disabilities, learning disabilities. Such causes may consist of the prenatal causes. The prenatal causes are genetic causes, that is Down syndrome, Usher syndrome, trisomy 13, trisomy 21, mosaic, translocation. Multiple congenital anomalies, that is charge association, hydrocephaly, microcephaly. Abnormal prenatal brain development, maternal age, that is under 18 years or over 35 years. Maternal infections, that is rubella, tuberculosis or other infections. Maternal nutrition, that is insufficient of nutrition. Maternal exposure to X-rays in the early stages of pregnancy. Maternal ailments, that is chronic hypertension, diabetes, Rh incompatibility in mother and baby's blood. Maternal use of wrong drugs or excessive drugs. Physical or emotional trauma during pregnancy. Attempts for abortion. Maternal convulsions during pregnancy. The next is natal causes, that is perinatal causes. Prematurity, the gestation period before 35 weeks or after 42 weeks. Low birth weight. Apoxia, that is reduced supply of oxygen. Anoxia, completely deprived of oxygen. Low Apgar score. Birth trauma. Jaundice at the time of birth. Prolonged labor, a very difficult time while giving birth. Umbilical cord wrapped tightly around child's neck. Bleeding in brain due to injury during birth. Delayed birth cry or delayed time to breathe. The next is postnatal causes. Eye fever or convulsions that lead to brain damage. Head injury or trauma due to fall. Insufficient nutrition. Metabolic disorder, unable to assimilate fat, protein or carbohydrates. Infections, encephalitis, meningitis, mumps, measles, tuberculosis. Certain neurodegenerative disorders, strokes, asphyxia. Cortical visual impairment is a neurological disorder caused by brain damage. The cortical visual impairment is caused by brain injury, children with cortical visual impairment often have a multiple mental and physical disabilities in addition to vision loss. Cortical visual impairment is frequently associated with other neurological abnormalities such as mental retardation 87%, cerebral palsy 74%, quadriplegia 21%, seizure disorder 66%, bilateral hearing loss 15%, and progressive CNS degeneration. The causes of cortical visual impairment include prenatal causes, antenatal drug used by the mother, cardiac arrest, twin pregnancy, central nervous system developmental defects. The next is natal causes, asphyxia, that is deprivation of oxygen, hypoxia, that is a lack of sufficient oxygen in the body cells or blood, ischemia, that is not enough blood supply to the brain. Postnatal causes, head injury, hydrocephalus, infection of central nervous system, that is meningitis, encephalitis. It is caused due to the underdevelopment of the optic nerves. The optic nerve, which is responsible for transmitting visual signals from the retina to the brain, has approximately 1.2 million nerve fibers in the average person. In those diagnosed with ONH, however, there are noticeably fewer nerves. It is often associated hormone deficiencies, developmental delay, and brain malformations. The causes are prenatal, young maternal age, prime parity, that is affected child being the first child born to the mother, maternal use of recreational drugs, anticonvulsants or antidepressants, viral infections during pregnancy, fetal alcohol syndrome, low maternal weight gain, weight loss during pregnancy, gestational vaginal bleeding. The next is natal causes, that is increased frequency of delivery by cesarean section, increased frequency of fetal or neonatal complications, preterm labor. Deaf blindness is a combination of visual and hearing impairment and comes in varying degrees. The major causes of deaf blindness are prenatal causes, maternal infections, toxoplasmosis, syphilis, rubella, AIDS, illicit ototoxic drugs used during pregnancy, other tetragens, that is radiations, pollution, toxic agents, maternal specific malnutrition, trauma to the fetus, abnormal prenatal brain development, genetic condition and syndromes, Albert syndrome, Asperger syndromes, Bardet-Biedl syndrome, Cockayne syndrome, Crouzon syndrome, Down syndrome, Dune syndrome, Friedreich syndrome, Goldhenner syndrome, Hunter syndrome, Marfan syndrome, Mobius syndrome, neurofibromatosis, Norio syndromes, optico-cochleodentate degeneration, Refsum syndrome, Turner syndrome, Wilder-Wank syndrome. These syndromes, that most commonly cause deaf blindness. The another syndromes are charge syndrome. It's a collection of 6 multi-system congenital anomalies that includes C for colopoma of the eye, H represents the heart malformation, A represents atresia of the cochlea, R represents the retardation of a growth or development, G represents genital abnormalities, E represents the ear abnormalities. The second one is trisomy 13-15 syndrome. The chromosomes are found in a pairs. In case of 3 chromosomes in the 13th pair is responsible for this syndrome. A significant percentage of children born with this condition during infancy. Most of those who survive have a severe mental retardation and marked physical characteristics. Varying degrees of auditory and visual complication may be present. Trisomy 18 Edwards syndrome means it is recognizable in the infants as the head is narrow and prolonged with a bulge at the back of the skull. Both visual and auditory complications are present. A very small percentage of infants survive to childhood. These children have a low birth weight and fail to thrive. Females achieve longer survival rates than males. Usher syndrome. Usher syndrome is a genetic condition which affects hearing and sight. The hearing loss, which is usually profound, is apparent from birth, while the sight loss may not be noticed until the individual has reached young adulthood. The vision becomes impaired when the retina stops functioning due to retinitis pigmentosa, causing firstly night blindness and then tunnel vision. Hearing levels, however, usually remain stable. There are 3 types in Usher syndrome. Type 1. In type 1, profound hearing loss is present from the birth itself. Poor balance, retinitis pigmentosa is noticed before the age of 10. In type 2, partial to severe hearing loss is presented from birth. Normal balance, retinitis pigmentosa is noticed before the age of 20. Type 3, normal sight and hearing at birth. When retinitis pigmentosa is diagnosed, there can be mild to moderate hearing loss present. Both hearing loss and retinitis pigmentosa increase through the adulthood. The next is natal causes. Premature birth, low birth weight, birth trauma or injury, low APGAR scores, jaundice requiring transfusion, hydrocephalus, microcephalus, central nervous system disorders, that is cerebral palsy, craniofacial anomalies, that is malformation of pinna, ear canal, absent vertical groove between the base of the nose and the border of the upper limb, and low hairline, anoxia or lack of oxygen, use of instrument, adolescence mother or pregnancy involving multiple births, location of placenta, position of fetus, membranes rupture early. Postnatal causes. Genetic syndromes like Usher syndrome, infections like rubella, cytomegalovirus, meningitis and encephalitis, asphyxia, that is stoppage of breathing due to obstruction in the air passage, seizure, fits, brain tumor or malformations, direct trauma to the eye and ear, severe head injury, near drowning event, family history of both vision and hearing loss, multiple disabilities and aging. These are the causes comes under postnatal. Dear students, I hope you understood the definition for visual impairment with multiple disabilities and causes for visual impairment with multiple disabilities through my lecture. Thank you.